Hello and welcome everybody to our webinar today on the Immune System Series, Lifestyle and Sleep Disturbances. My name is Agatha Aramayo. I am the Executive Director of the Foundation for Total Recovery. I am joined by our host today who will be presenting Dr. Gary Kaplan, who is the founder and medical director of the Kaplan Clinic, as well as the Foundation for Total Recovery. And I just wanted to let everybody know that our session today is being recorded, but no need to worry. Your information, your name, nothing like that will appear on screen, nor will we harvest any of that information. So any polls and anything that we have, don't worry about your personal information being shared. And if the screen looks a little funny, we will try to fix that, but for the sake of time, we're just going to go with this. Danita, do you mind going to the next slide, please? So before we begin, I'll just go ahead and share a little bit more about Dr. Gary. Dr. Gary Kaplan is a leader in integrative medicine. He's been practicing for over 35 years, especially specializing in immune-mediated chronic illnesses. He is also a clinical associate professor at Georgetown University and only one of 19 physicians in the country to be board certified in family medicine and pain medicine. He's also the author of 2 books, Total Recovery and Why You're Still Sick. We will be giving away a signed copy of Why You're Still Sick today at the end of this webinar, so stay tuned for that. I'll be announcing the winner at the end of our Q&A. The next slide, please. Yep, so we're gonna open up with an opening poll that I'm launching right now, just to get a gauge on everybody in the room today, just seeing how everybody's sleeping. So how would you rate your sleep quality in the past week? So if you think you've gotten a really restful sleep, 7 to 8 hours, if it's just been okay, poor. And then a second question here, what's the biggest factor that's keeping you from getting good sleep? Is it stress? Is it screen time? Is it pain? I know we have a lot of people that attend our webinars that have chronic pain and such. Do you have an irregular schedule like me? And then did you know that not only is good sleep equating to the hours that we get, which is a common thing that we hear, getting 8 hours, getting 7 to 8 hours, it's also having a consistent sleep pattern, but that's what Dr. Gary will be talking about a lot today. And all right, so I'm getting a lot of responses here. It looks like I'm sharing that with everybody. Overall, everyone's just kind of okay, which is, pretty predictable. And the biggest reason for that might be stress or racing thoughts. No shocker there, stressful times for sure, probably for everybody. Pain is probably second here. Other in a regular schedule are after that. So thank you for sharing. Just wanted to gauge everybody in the room. And with that, I will be able to turn it to Dr. Gary for the presentation today. And again, if you have any questions, just put them in the chat. Only I will be able to see them along with Dr. Gary, but enjoy.
Good afternoon. I am delighted to be able to talk with you today. And sleep is one of my favorite topics, something I don't get enough of, but have been studying literally since I was in college. My honors thesis in college was on the neurochemistry of sleep. So something that we find kind of foundational in terms of health, and particularly your immune health. So if I can have the next slide, the sleep, we all have different patterns of sleep, right? So one researcher, Dr. Reyes, has outlined 4 different types of sleep. And you should look at this and think about what type of chronotype, we refer to them, what type of sleep you are. Are you a lion, sometimes referred to as an early bird or a lark, where you're waking up at 5 and 6 in the morning, you're getting to sleep around 9 to 10, which is your kind of ideal slot. And exercise works better for you in the morning. Or are you a bear, where you find that, you get to bed about 11 p.m. and you wake up at 7 a.m. Your energy holds mostly throughout the day. You kind of align yourself with sunrise and sunset. Mid-morning, it's a great time for you to be working, and you need to take a little break in the afternoon. Wolf owl types, they're the night owls, right? I mean, they're going to bed between 12 and 1 in the morning, and getting up between 8 and 9. They're creative, introspective. They work late into the afternoon and evenings. And the dolphins are interesting because dolphins actually sleep on the go. But in this case, irregular schedules, poor sleep qualities, light sleepers, they tend to be individuals who are intelligent, anxious, and perfectionists. Strict bedtime routine is kind of the thing that's extremely important for you, and turning off all kind of electronics. So you're not necessarily purely any one of these, but it's important to think about what in fact your ideal pattern is and then be respectful of that, because you'll find yourself far more productive. So I kind of fall between the lion and the bear. And I find that my best time for exercise is in the afternoon, evening, not during the morning. I don't do so well in the morning. So you want to find that out, because then you're going to feel better about yourself all day long in terms of what you're doing. But I get a lot of work done early in the morning also. So what makes sense for you? Think about it in terms of these are actually subdivisions of how people, uh, how their circadian rhythms work. Next slide, please. The other thing we want to talk about is this whole business of quality of sleep. So good sleepers versus weekend catch-up sleepers, insomniacs, and nappers. Okay. So consistently sleeping about 7 to 8 hours. Now, that's different for age groups, right? So if in fact you're a teenager, you need about 9.5 hours of sleep a night. And I don't know many of our teenagers who get anything close to that. But the reality is they belong getting 9.5 hours of sleep a night is kind of ideal for them. For the rest of us, 7 to 8 hours, depending upon what makes sense for you. And as you get older, typically you need a little bit more sleep or sometimes less sleep. Um, the key is making sure you've got regular bedtime and regular wake time. The more disciplined you are about structuring your sleep, the healthier you're going to be. Uh, the catch up sleepers, this business of trying to you build a sleep debt, right? Yeah, I get 5 to 6 hours of sleep, which I saw most people on the poll are doing. 5, 6 hours of sleep isn't going to cut it. It's not enough time. And I'll explain why and why it's so important. Remember, we spend about a third of our lives sleeping. And sleep, as such, is a very, very necessary physiologic thing. This business of creating sleep debts where we sleep, okay, 5, 6 hours during the week and then we'll make it up on the weekends, it doesn't work. We think it works, but it doesn't work. You end up overall with higher inflammatory generalized, and you end up with increased metabolic risk in terms of becoming diabetic, in terms of developing thyroid disease. So there's a lot of problems with this catch-up business. The insomniacs, trouble falling asleep, staying asleep. So insomnia isn't just about trouble falling asleep. And normal sleep time should take latency is about 10 to 20 minutes. Over that is considered a problem. So 10 to 20 minutes, or sometimes hopefully just hitting your head on the pillow and you're out. But 10 to 20 minutes max is fine. Longer than that, starting to move into the insomnia category. Waking up multiple times a night or single times a night is also considered a type of insomnia. So we want to pay attention to that, and we want to address those issues. For instance, if you're consistently waking up around 3 in the morning, from an acupuncture standpoint, that's the time of transition from liver to lung. And if you're finding congestion within liver, meaning frustration, anger, uh, then you're going to have trouble making that transition. And so there are things that can be done from an acupuncture standpoint to help you make that transition. Indeed, there are things we can do throughout your sleep cycle with acupuncture that can help with improving your sleep overall. Nappers, they get adequate sleep and they nap during the day. Personally, not a good thing for me, but other people find napping helps. If you're going to nap, there's two ways to do it. Cat nap, which is under 20 minutes, or full cycle. Sleep cycle is 90 minutes. And so sleeping for a full 90 minutes is kind of the ideal thing, because that gets you through all your sleep cycles. Again, remember, you have to be careful because nappers tend to have higher fragmentation of their sleep rhythms, and they tend to have uh, more autoimmune diseases. Next, please. So there are three things that are kind of the formation in terms of sleep. Timing, so what time you get into bed and making sure you're doing its consistency. The quantity, how long are you sleeping for? And the quality, and that's, are you waking up during the night? Do you feel rested when you wake up in the morning? You have the next slide, please. So let's talk about sleep stages, and I'll go at the cute little puppy. Next slide, please. So sleep isn't a thing, it's a bunch of things, okay? And we divide them into these different cycles. We have stage 2 sleep. Stage 1 is this period where you're just starting to go out. And if you have this business where uh, you get quick images and then kind of startle yourself awake, thus the phrase falling asleep, because you feel like you're falling. And those quick images are theta waves. And what happens is that theta imaging is different than REM. REM will create a whole story in terms of dreaming. Theta waves gives you just these quick images. So that's the difference between REM and theta, and also stage 1. Stage 2 is an axial period. We'll talk more about that in a minute. It's essential to get from one stage to another. Stage 3, 4 sleep, also now called N1 or deep sleep, N3 rather, or deep sleep, is crucial for other reasons, and REM period is crucial for yet another reason. So if we go to the next slide, we've outlined what these different sleep stages do. Next. That's not correct. Nope, not where we want to be. Let's go back. So we're supposed to be having stages of sleep here. And there we go. There's our stages of sleep. So the light sleep, typically, you're only about 5% of the total night in that light sleep period. You're easily woken up during those time periods. You can get muscle relaxation and twisting. And this is this where you can get these theta wave bursts that end up with these images, and also where you can jerk asleep, jerk awake rather. Stage 2 is really important and is in fact the majority of the night, or should be the majority of the night if you're cycling properly. So stage 2 constitutes almost half the night's sleep. Um, we define these stages by what happens on EEG, electroencephalogram recordings. So different complexes, sleep spindles versus delta waves versus high frequency waves, will define the different stages of sleep. But what's happening is your body temperature drops in stage 2, eye movements stop, brain filters out noise, your heart rate slows down, and now what's happening here is you've got consolidation of memory. But the memory is more a functional memory, learning task in doing things, which is different than creative memory, which happens more in REM. Uh, it is the gatekeeper. You have to go through stage 2 to get to stage 3 and to get to REM sleep. So it's really important, and we watch this when we do sleep recordings to see whether or not you're passing through all of these stages and how you're doing so. Stage 3, previously known as 3-4, non-REM sleep, slow wave sleep, about 18% of the night normally. Extremely important purposes. So one of the questions is, why do we sleep? Right? Well, one of the reasons we sleep is we have to detoxify the brain. And what happens is the brain doesn't have a lymphatic system. So the lymphatic system is the drainage system throughout our entire body. The brain is connected to the lymphatic system. And we only figured that out about 5 years ago with some researchers at the University of Virginia, where they found that there are actually connections to the lymphatic system with the brain. Previously, we did not know that existed. But the brain itself doesn't have lymphatic channels. But what happens is during slow wave sleep, the glial portions of the brain, not the neurons, form this thing called lymphatics. And what happens is they become the drainage ditches to remove the metabolic waste. Now, why is that important? Brain is the metabolically most active organ in the body. And so it generates a lot of waste material. Those waste material actually cause swelling of the tissue and need to be drained out. And it occurs some during the day, but it really occurs mostly during stage 3 sleep. So getting that sleep is absolutely essential to detoxifying your brain. So we want to make sure that we're getting good amounts, about 18% of the total evening's store of stage 3 sleep. So extremely important in order to keep our brains focused, concentration. We don't have that brain fog. It helps with our memory as well. Now, the next thing, however, is REM sleep. So REM sleep is this business where we've seen this in our animals where they'll be jerking or they'll be barking if they're a dog, and but their eyes are closed, and this is dream sleep. This is where you get the whole stories going on about what's going on, and brain is consolidating memories and processing things during this time period. And so it's essential for normal neuroplasticity. It's essential for mental resilience. And so you want to make sure and that's also about 20-25% of your evening. So you want to make sure you're getting all of the stages of sleep. And if your sleep is really interrupted, you won't tend to get it. Typically, stage 3 sleep occurs more frequently earlier in the evening, and later in the evening is when REM sleep comes in. Now, if I put you in a sleep lab and I wake you up every time you go into stage 3 sleep, inside of 1 week, you will have generalized pain. You'll look like you got fibromyalgia. There is one exception to this, and we've never quite understood why that is, but long distance runners. If I wake you up during REM sleep, so we don't allow you to get any REM sleep, inside of about 3 to 4 days, you'll be psychotic. You will start having REM pressure, which means you start having dream cycles during waking periods. So you literally start hallucinating. So REM is crucial, and the body's going to get REM one way or the other, and the body's going to get stage 3 sleep one way or the other. But the less you get of both, the worse you're going to be feeling. Next slide, please. Okay, so let's talk about some disorders that occur in sleep. Next, please. So there's all kinds of disorders, and obviously the number one is really insomnia. And unfortunately, as noted on the uh, hello, early trial that we did, we found that a good number of you were only getting about 5 or 6 hours of sleep a night, so not enough. Difficulty falling asleep, waking up frequently, frequently feeling unrested after sleep, drowsy, difficulty focusing if you're having issues with insomnia. And that affects 30+% of the people in the United States. The problem is chronically, that puts you at a lot of health risks. So much higher risk in cardiovascular disease, much higher risk of weakening of your immune system, making you susceptible to more infections, much higher risk of hormonal imbalances, can lead to problems with loss of libido and erectile dysfunction, and of course, the risk of diabetes and weight gain. All right. There's a large number of ways to treat that. We'll talk about that in a little bit. Next slide, please. Daytime hypersomnolence. So, daytime hypersomnolence means that you are sleepy all day long. Okay. And up to 20% of the population experiences this daytime hypersomnolence. It can be a result of a number of things. Uh, Either napping too much or too little. It can be a result of having problems during the night sleeping. It can be a result of a couple of sleep disturbances that we're going to talk about in a minute, which include sleep apnea. It could be a symptom of narcolepsy. So we'll get to that in a minute. But basically, you're having trouble focusing, concentrating. And so we need to understand what the underlying problem is. We need to understand uh, how to go about changing it. And obviously, things like avoiding caffeine and alcohol before bed. We want to make sure that you're not taking medications that are causing you to be excessively sleepy during the day. And things like cognitive behavioral therapy can be one of the ideal things for treating both insomnia and sometimes for addressing daytime hypersomnia. Next slide, please. Sleep apnea. Sleep apnea is a huge problem and mostly undiagnosed. We're talking 30 million plus people. We're talking 85% of people who have sleep apnea don't know they have it. So it's really important that it gets diagnosed. And one of the symptoms of it that you'll see is loud snoring and gasping, choking during the night. You can actually stop breathing. Daytime, you're dragging. You never feel rested when you get up in the morning. You can have a headache in the morning. All right. Poor concentration, focus. And again, it will lead to problems, hormonal problems. You can also see problems with hypertension, problems with cardiac arrhythmias, stroke, AFib, problems with insulin resistance, okay? And it can take 10 years off your life. So sleep apnea is a big deal, all right? And there's lots of ways that we can treat it. CPAP is far and away the most effective in terms of doing it, but we now have devices we can implant that will stimulate the tissue in the back and throat to tighten it in order to give your airway open, keep your airway open. But avoiding alcohol, certain sleeping pills will certainly create the problem. Positional therapy, where we'll actually strap tennis balls to your back so that every time you roll on your back, sleeping prone, which is where some people have the most problem, you get uncomfortable, so you roll back over. So go to the next slide because this is an important little test. It's easy, it's simple. Take a look at it. This is the Epworth Sleepiness Scale. Okay. Answer these questions. If you score 10 or more, we need to have a conversation. So you want to know whether or not do you get sleepy or doze off while sitting and reading? Never happens. Slight chance of happening, moderate or high chance of happening. And you don't have to fall fully asleep, but you just kind of doze a little. You catch yourself. All right. So take a look at these things. And I will tell you that I had one of the highest scores on the Epworth scale when I first was introduced to it because I had pretty severe sleep apnea. And so I sleep with a CPAP. CPAPs are tough to get used to, but they're life saving. And they can make all the difference between having high blood pressure and having diabetes and obesity, and shortening your lifespan and having a good full life. So they become a bit of a joke because you can look a bit like Darth Vader wearing them, but CPAP save lives. And it's extremely important if you do have sleep apnea that we address it and we got to treat it. Next slide, please. One of the ways we can diagnose it is using a thing called a watch pad. The watch pad is a device we can send you home with. It slips on the end of your finger, has a little watch-like device that goes around your wrist. There's a little piece of microphone that tapes to your chest to record snoring. And so the watch pad is an FDA-approved device and an extremely effective way, an easy way to diagnose sleep apnea at home. So we give you the WatchPat device, you take it home, you download the information to your iPhone and ship it over to us and you throw the rest of it out. So not necessarily environmentally sound, but certainly very simple. Next, please. Narcolepsy. Narcolepsy is actually more prevalent, especially in my population with autoimmune diseases, than you would think. There's essentially two major types of narcolepsy. Narcolepsy with cataplexy, which is kind of the classic way people think about it. They start to laugh, they have strong emotional response, and then they collapse like they've just fallen asleep. Um, they haven't actually fallen asleep. We used to think they used to go into REM sleep, but they lose all their muscle tone uh, as a result of the sudden emotion. Uh, During the night, they can have sleep paralysis. Sleep paralysis is where you're kind of awake, but you can't move, which is fairly terrifying. And you can have hallucinations. Type 2, you're just daytime sleepiness. So we need to make sure that if you have hypersomnia, that is you're sleepy during the day, that A, you don't have sleep apnea, and B, you don't have narcolepsy, because those have to be treated differently. So making sure that we distinguish between the two types, and there's some blood tests we can do. We need to know that autoimmunity can cause narcolepsy. And you can also have it as a result of concussion. You can have a result of stroke, tumors, or other issues such as MS. So narcolepsy can occur secondarily or it can occur primarily. And it's crucial that we diagnose it. Now, next slide, please. Narcolepsy needs to be diagnosed in a sleep lab because the way we diagnose narcolepsy is first we rule out that you don't have sleep apnea because you have sleep apnea. We have to fix that first. Second is we put you in a sleep lab and what we do is we let you take naps. So you get a chance to take 4 different naps and we've got you monitored in such a way so that you lie down for 20 minutes. We want to know, do you fall asleep? Do you go into REM? If you go into fall asleep and go into REM a couple of times, you have narcolepsy. That's your diagnosis. And then there are specific medications that we want to treat you with. If you don't have narcolepsy, then we can treat daytime hypersomnolence in a different way. But we have unique ways to treating all these things, which is why it's so important that we make sure we get the right diagnosis. Next slide, please. So complex illnesses that affect sleep is really a big deal. Next slide, please. If you have things like Bartonella, okay, Bartonella does a real trip on the nervous system. And in fact, if you have BART, it can be really challenging to get you to sleep. We see, especially in our kids who have Bartonella, their sleep cycles can completely reverse. They'll be going to bed at 6 in the morning and waking up at 4 in the afternoon. So you get a complete reversal of your circadian rhythm, which is not good for you either. So realistically, unless we fix the BART, we're not going to be able to fix the sleep cycle. So we need to make sure that we're addressing the underlying problem in addition to helping with sleep. It's not just a matter of fixing the sleep. Again, if you're tired all day long and we give you a sedative to sleep and you have sleep apnea, we've just made the problem a whole bunch worse. So we need to understand specifically why you're having trouble sleeping. If you have heart disease, we need to make sure that we're addressing that underlying problem. If you've got obesity and that's creating sleep apnea, we also need to make sure that we're addressing that. So there's lots of things, problems that can occur with dementia, problems that can occur with depression. All of these things worsen your sleep and increase your mortality risk. So they can make the underlying condition much worse and they can increase your chances of dying. So it's important that we understand sleep disturbances within the context of what's going on with you. Next slide, please. So better sleep strategies, right? Next slide. Most of you heard this. I'm going to repeat it. Consistent sleeping, time going to bed and waking up. The more you're disciplined in sleep, the healthier you're going to be, and making sure you're getting adequate sleep. You want a sleep friendly environment. The reality of the matter is rooms need to be dark, they need to be quiet, and they need to be cool. So and you can sleep under a bunch of blankets, but if the room itself is cool, so your head is cool, all right, that's good. So you want the room temperature about 68 degrees. You don't need to see your breath to prove that you've got the room cold enough. And we're all different in terms of how we respond to this stuff. My wife will sleep with a sheet over her at the room at 68 degrees. I will sleep with the blanket, the sheet, the comforter, and maybe another blanket. So, we're all different, but the reality of the matter is we're going to sleep best in a cool environment. All right. You want to make sure that you have some downtime before you go to bed, preferably off all screens. All right. Not reading or scroll dooming on your phone or your iPad, but also you want to stop thinking. You want to just quiet things down. We prefer actually reading on an actual book if such things can be found anywhere. You want the environment quiet, and if not quiet, at least have a white noise machine that'll block out some of those sounds. You can use earplugs, but you want to have an environment that's going to help you fall asleep and stay asleep. You want to make sure you're not drinking coffee. As a friend of mine says, it's not the morning coffee that gets you, it's the espresso at 3 in the afternoon that'll do you in. Now, there are type 1 and type 2 metabolizers of coffee. So some people can drink coffee just before they go to bed and have no problem whatsoever. That would be my wife. I, on the other hand, can't drink coffee after 1 o'clock in the afternoon or I'll be up for the rest of the week. So you need to be respectful of what works for you. It's not a function of everybody works the same. Exercise, you typically want to, if you're going to work out heavily, you want to do so at least 3 hours before you go to bed. You also don't want to eat any heavy meals for several hours before you go to bed. So you want a full wind down routine where you can quiet, stretch, quiet conversation with your significant other. Just quiet down. And that's not the time to do deep problem solving, by the way. You want to pay attention to your nutrition. You want to make sure you're not doing sugar highs. You want to make sure that you've got foods rich in magnesium and tryptophan. You can use, melatonin. You can use herbal teas, magnesium threonate. We'll talk about those in a second, a bit more. And there are cognitive behavioral strategies that can be extremely effective and our first line treatments for most people having any trouble sleeping. And then, of course, you want to monitor your sleep so you actually know how much you're sleeping. And that can be done with the Oura Ring, that can be done with the Apple Watch, that can be done with the Whoop. There's a whole bunch of different ways to keep tracks of that. And we look at that stuff because it helps us understand how well you're sleeping and whether or not you're waking up multiple times during the night and whether or not you're getting the full cycles. Next slide, please. So in talking a little bit more, there's a slide missing. Go to one more slide. Nope, go back. Okay, so just talking in general in terms of how we approach things, first and foremost, we need to hear your story. We don't treat things in isolation, we treat them in context. So we need to understand how you're doing. I need to know how you're sleeping. I need to know issues in terms of your nutrition. I need to know about your exercise pattern, your activity pattern during the day. I need to know what your energy is. I need to know about your pain. Because pain, as you saw on that early slide was one of the main reasons people were having trouble falling asleep and staying asleep. You want to make sure that we understand what the underlying problem is. Again, if you've got an underlying infection such as Bartonella, if you have autoimmune encephalopathy, that is, your brain's inflamed, that's going to create problems for you long term. So we need to understand what's going on and whether or not there's an underlying or inflammatory disease going on in your body. We identify that. We then have to go about treating it, treating both the underlying cause that has created the problem as well as treating the problem itself. And remember, from our standpoint, we look at the inflammation that occurs in the brain as something of a bank shot. So what happens is you have a weakened immune system. You then have an issue where you get an infection. That infection, in the process of antibodies being built to that bug, the antibodies mistake your own tissue, typically the brain. And now what happens is you have both the bug itself as a problem, but now you have your own immune system attacking your brain. That's further the problem. And so now it's a matter of cleaning the whole thing up, getting you back to an optimal level of health in order to see you completely recovered. Next slide, please. And Agatha, you're on.
Yeah, that brings us to the end of the presentation today. Thank you, Dr. Gary, for a really informative session. And again, I want to apologize to everyone. I promise this is not a user error situation today. We've tried everything with Zoom, but for some reason, it's just frozen in this manner. But we will be sending out the slides to everybody. That way you'll be able to see things more informatively and keep that resource for yourself. We'll also be sending out a recording of today's webinar. So if you weren't able to catch it live or wanted to share it with someone, you'll be able to do that. But that brings us to the giveaway and raffle section of the webinar today. So if you were interested in winning a copy of Dr. Gary's book, Why You're Still Sick, just raise your hand here in the chat. You can do that by clicking the icon at the bottom that says raise your hand and select it. And I will be able to select a couple of winners. One will get a copy of the book, and then two others will be getting some small gifts. All right, so I will be jotting that. And that takes us to Q&A. So Dr. Gary, we did have some questions here that I will be able to share with you. So one question we had that was pre-submitted was, someone said that they sleep generally pretty well, but it seems that going to the restroom in the middle of the night tends to interrupt their sleep. So they'll get about 4 to 5 hours, wake up, go to the restroom, and then it's hard to fall back asleep. Reading seems to have helped that for a bit, but she was wondering if there was anything else that could be done to kind of curb that, that from happening.
So good question, and important because it's very frequently a problem. So one of the things that can help with that is acupuncture. Acupuncture and some herbal approaches can frequently help that because, as we discussed, sometimes getting up in the middle of the night is a result of, from an acupuncture standpoint, liver congestion or some other identifiable issue, and acupuncture can be helpful. Cognitive behavioral therapy can also be extremely helpful. The other thing is you want to pay attention to how many times you're waking up at night. I had one patient come to me who was waking up, not exaggerating, 19 times a night, right? He'd been to the urologist. They've had all kinds of workup on him. I said, let's see what your sleep looks like. He had severe sleep apnea. So what happens is when you've got severe sleep apnea, you stop breathing, your blood pressure is going up, you're spiking your adrenaline, and you need to pee. So that's getting up at night, multiple times at night. We fixed his sleep apnea, and lo and behold, he was sleeping through the night. So we want to understand again why it is you're getting up to sleep. But it's not unusual that some people's pattern is they wake up in the middle of the night, they need to urinate, and then they get right back to sleep. It's when you don't get right back to sleep that we want to address it. My first pass on that would probably be acupuncture, because I think it's extremely effective. Sometimes taking a little magnesium, thionate in particular, can be helpful to help you get back to sleep. And cognitive behavioral therapy is another approach to doing it if it's particularly severe.
Great, thank you. Kind of in that similar vein, someone is asking if acupuncture can help patients whose axis is off.
Axis is off, meaning that the sleep cycle is off?
I am not sure, but yeah, axis is off. So I guess if you could address it, if their sleep axis is off, and I think, does that also typically mean something else?
Well, so if the stages of your sleep are off, meaning that you're not getting adequate sleep, Acupuncture might be helpful for that. There are medications that we can use for that, but we think we want to take a look at a more fundamental issue in terms of what's going on with that. So if you're not getting adequate stage 3 sleep or REM sleep, uh, certainly if we find that you get a lot of REM sleep early in the morning, or I'm sorry, early in the evening, that's called REM pressure. And that suggests either you're not getting enough sleep or that in fact you have narcolepsy. So we want to pay attention to what's the underlying problem of the distortion of the sleep cycles. Acupuncture may be helpful for it, but first, second, and third is diagnose the problem. And then we can figure out what the solutions are. There are medications that will particularly help generate slow wave sleep.
Awesome, thank you. Oh, and then they clarified actually spine axis in the top cervical area. So if acupuncture would be something kind of aligned with that.
You're talking about instability in the cervical spine, okay, or tethered
Yeah.
cord. That's a different problem. And again, that's going to take a little bit more thinking about what's going on and diagnosing the severity of the problem.
Yes. And thank you for clarifying. All right. And someone else is asking if Bartonella is significantly complicating their ability to fall asleep, would you try to attack the Bartonella first before Lyme and other co-infections?
Oh, that's an excellent and extremely challenging question. As a rule, what we do is Lyme first, or Babesia first, and then Babesia, and then Bart. Why? Because we find that once we've cleared those two infections, it's much easier to clear the Bartonella. We also find that if Babesia is present, Lyme can, if you will, hide under, or Bartonella can hide underneath Babesia. And so meaning that it won't show up initially on our testing and will show up later. But the reality of the matter is we got to go after all of them. And you take it in a stepwise manner. We do what we can also to help you sleep. So that may require either supplements or some medications in order to accomplish that. Uh, but it's a challenging problem and one that requires a comprehensive approach in the process of helping you recover.
Great, thank you. All right, and then someone is asking, what would be an ideal time for bedtime? Would it be 10 o'clock? This person tends to go to bed at 11 p.m. and get up at 8.
That's kind of an ideal time for you. That works. I mean, that's why we went through those chronotypes, that everybody's a little bit different. Everybody needs a little bit different sleep schedule. So if that's what working for you and you're up and ready to go, perfect. Some people, look, 7 to 8 hours is a ballpark, right? We really don't want under 7 hours, but 9 hours is okay. We also don't want more than 9 hours though, because 9 hours also weakens the immune system. So we want to keep it in that window. Again, unless you're a teenager. Teenagers, we want 9.5 hours ideally. Good luck if they ever get that.
Yeah. All right, and someone's asking, often when they're in severe pain, including with their TMJ, they'll take a nap to get a break from the pain, but can that impact their sleep cycle at night negatively?
Yes, it absolutely can. And it's a difficult problem, right? Because uh, first off, we want to make sure if you're getting pain from TMJ, we really want to make sure we've got you on a proper dental appliance to address the TMJ. So that's not necessarily going to fix it, but it will mitigate the consequences of it. So getting a proper dental appliance is extremely important. We also then want to look because we're going to find that there may be a deficiency in slow wave sleep. Somebody who's got generalized pain problems. So there are medications that we can use to help address that particular part of the problem. So there's a lot of work that has to be done. Uh, it's not simply here, take this pill and you're fixed. We need to understand the whole thing in context and address it accordingly.
Great. All right, another question here. Someone said they get about 7 hours of sleep with 13% of it being deep. How can they improve deep sleep?
So meditation, which we didn't talk about earlier, can be one way to help rebalance your system and can be extremely effective also for helping rebalance the stages of sleep. Exercise can be extremely effective in helping rebalance the stages of sleep. And so making sure you're getting good aerobic exercise and anaerobic. So you're doing weights in addition to aerobic exercise because you get different chemicals released from those two types of exercise. So those things will certainly improve your situation. Otherwise, then it becomes a matter of looking at some medications. Melatonin can be effective. Melatonin is a nice anti-inflammatory in the central nervous system. Taking maybe 3 milligrams at bedtime might solve that problem as well. So there's a number of things that we can look at and need to address to address that issue.
Great, thank you. Someone is asking, when should you take magnesium to get benefits for better sleep? And again, I'm sorry, we had a slide on this. We had some tech difficulties. We'll send that out. But yeah, Dr. Gary, when would you recommend someone take something like magnesium?
I would do magnesium about 20, 30 minutes before you go to bed. And specifically, I would do magnesium threonate. Uh, Best magnesium for crossing the blood-brain barrier, least impact on the gut, right? So magnesium glycinate will tend to stimulate bowel movements. So you want to make sure that you're taking the right magnesium at the right time. So magnesium glycinate probably during the day to help with bowel movements, magnesium threonate at bedtime to help with sleep. And magnesium citrate also, but much more powerful in terms of a stimulant for the gut. And that you would take during the day, not at night.
Great.
Oh, and I want to go back on one thing. In terms of sleep cycles, stage 3 sleep is one of the toughest to measure effectively with the different devices that we wear. Probably the Aura Ring is the best at doing it, but it's still not perfect and not as good as Sleep Lab. So you may be under recording how much stage 3 sleep in fact you're getting. And the other thing then to look at is, how do you feel in the morning? Brain fog, focus, concentration. Are you feeling alert and active? You're probably getting adequate sleep.
Great. All right. And someone's saying that they have chronic lymphocytic, I might be butchering that, leukemia under watch and wait. They keep waking up several times during the night and want to know if this could be due to their CLL, the chronic lymphocytic.
Yeah, CLL in and of itself shouldn't be creating a problem with sleep. I would want to know what your inflammatory markers look like, C-reactive protein or SED rate, whether or not there's a lot of inflammation. And then I would also check your sleep. I would put a watch pad on you. I want to see what your sleep patterns look like. Again, we need to view everything in context and not just blame things on one thing or another.
Great. All right. And then someone's saying, if they don't get a good night's sleep, what's the best thing to do the next day to prevent any pain flare-ups or any other consequences? So this person may have some pain issues.
You can take a short nap, but the reality of the matter is kind of the best thing to do is get yourself through the day as best you can. Pay attention. If you've not slept well, your reaction time is going to be decreased. You're higher risk of having an accident, higher risk of making mistakes at work. So you need to pay attention to that. And so uh, the best thing you can do is just kind of get yourself through. You can take a nap, but you don't want to and do a 90-minute nap. Sometime earlier in the day, midday, but you want to get back on a normal sleep schedule as fast as possible.
All right, great. Another question here. So if someone's asking if they get enough hours of sleep, but they're still waking up exhausted and foggy, could that mean their sleep cycles or their immune system aren't functioning properly?
Well, it can mean several things. One thing it can mean is that you've got sleep apnea. We would have to test for that and see whether or not that's the problem. I would test your sleep with something like a watch pad because I want to see what your cycles look like. We can guess or we can do a proper diagnostic workup. And I prefer the proper diagnostic workup to see what's going on. We also want to take a look at, are you hypothyroid? Do you have other metabolic problems that may be creating problems? So again, it's about in context. It's about making sure we understand the complete picture and not just focus on the symptom.
Got it. All right. And then someone's asking what they should eat in the morning for breakfast when they wake up.
I think having what you shouldn't have is orange juice. Orange juice is nothing more than a glass of sugar, and it just spikes your insulin levels, and it's really the worst thing for you. And many of us were brought up that, it's not breakfast if you haven't had orange juice. You want a small glass, you can. If you want to drink some juice, you can drink tart cherry juice, which actually has nice anti-inflammatory properties, especially for joint pain. But for the most part, it should have a protein. Okay, it can be an egg, it can be salmon. and not a huge meal. Okay, so but a comfortable meal to get you through your day.
Sounds good. I'm taking notes for myself too. All right. Someone's asking if they follow a good sleep pattern during, let's say, Sunday through Thursday, like kind of like the weekday schedule. Is it okay to sleep later in on the weekend, like
It
Friday,
is. It is. You can you can get away with doing that. Just pay attention to how you're feeling. But yeah, you can get away with doing that. So you want to party one night, go.
Saturday? All right. And then someone is saying that they have restless leg syndrome from tearing an ACL years ago and had an Apple Watch to monitor sleep. No problem falling asleep and sleeping through the night, with the exception of the bathroom, but deep sleep seems to only be about an hour. So, could the restless leg syndrome interfere with Apple Watch monitoring?
Well, actually, it's an extremely important question. And if you've got restless legs, you've got a different issue. I don't believe it's from the ACL tear. Restless leg most commonly is associated with low iron. And so we want to make sure that your iron levels are adequate. And if anything, maybe pushed a little bit toward the upper end of normal. Then we find that restless legs resolve. Low magnesium can also create problems with restless legs. So we want to make sure that we're not looking at a metabolic imbalance that's creating the problem. So, and as far as the recordings on the watch are concerned, yeah, it's going to get disrupted by virtue of the movement, and it may mistake awakenings
Mm,
um, for the restless legs.
great, thank you. All right. Do you have a preferred treatment, Dr. Gary, for sleep apnea? I know there's a lot of things out there on the market.
CPAP. I like CPAP. You can take it on. You can take it off. It doesn't. You're not implanting anything into you. The surgical procedures are excellent for snoring, and about 20% of them fail somewhat down the line in terms of fixing the sleep apnea, which is the problem. Snoring is just an annoyance. So we really want to be. The fact of the matter is, the CPAP works the best. I also want to make just a quick reference. CPAP is continuous positive airway pressure. There are some people who have a problem with their brain where they actually forget to breathe. Okay. And that needs what's called a BiPAP unit. So what's happening is the machine, it's a little bit fancier machine. It monitors you and it notices when you've stopped breathing for a period of time, and then it will breathe for you. So there's two divisions actually of sleep apnea, if you will, in terms of where you stop breathing because you forgot to breathe, your brain forgot to breathe. See that in stroke patients, but we can see it in other people who have inflammatory brain issues. And then CPAP, where it's really a mechanical issue. But CPAP, hands down, works the best. Unfortunately, there's a very high failure rate for it, meaning people stop using it after several months. But it does work, and it doesn't involve surgery, and it doesn't involve implanting any devices into you on a permanent basis.
Awesome, great. And then another question here. Person forgot which animal it was in the chronotype, but the one where they catch up the sleep, or I think it's in the other side. They catch up on sleep kind of, I guess, on the weekend or after a bout of short nights of sleep. Does that have any adverse effects long term?
It does, because when that disruption of your sleep cycle overall sets the stage for inflammation in your body. Inflammation in your body sets the stage for cardiovascular disease, arteriosclerosis, hardening of the arteries. It sets the stage for more susceptibility to infections and autoimmune diseases. It also sets the stage for spiking your insulin levels and insulin resistance. So yeah, it has a lot of consequences, and you really want to. Sleep is crucial to us. Sleep is not an optional event, and the reality of the matter is we need to do everything we can to guard our sleep, and everything we can to make sure we're getting good night's sleep.
All right. Well, I think that wraps up our Q&A for today. But thank you, Dr. Gary, for a wonderful presentation on sleep. I know while I was helping you with this presentation, I realized I need to fix my own sleep. So thank you for sharing that information with us. And again, I will be sharing this slide deck and the recording with everyone today. And next is time to announce who's won I can't talk today. Who has won some of our prizes today? So for the main prize for a signed book by Dr. Gary is Joseph Plume. I hope I'm saying that correctly. And we have a Jane and a Lisa also. So thank you all. I will be emailing you directly to be able to give you, to be getting your mailing addresses. And I'll also be sharing a quick survey if you don't mind filling that out for us. Just giving us your thoughts on the webinar today, if this was helpful. Again, kind of an anomaly with the slides, but if the presentation was, shared some insight with you that you may have not known before, if you have any recommendations for us for any future webinars, we'd love to hear it. So I'll just give everyone a moment on that. And while everyone's filling that out, wanted to share that this webinar is part of our longer webinar series on the immune system. So we previously had one on overall on how different things affect the immune system and how they can cause dysregulation. This is the first one following that presentation. I'll pull it up in a moment here, but we will be having another one on Wednesday, November 12th, the day after Veterans Day, on therapeutic plasma exchange, again with Dr. Gary. So stay tuned right now for that code, but thank you for responding to the survey. And after therapeutic plasma exchange, we'd love to hear more. So feel free, if you have any questions that you want asked in that webinar, you can email them to info@foundationfortotalrecovery.org. If you had any suggestions or topics you wanted to hear about, feel free. We're there. We're here to hear you, see you, and recognize anything that's ailing you and that you're interested in, and being able to provide that information. But thank you very much. And then next slide, please. Well, actually, let me put that link in there. That was supposed to be in there, but I will share the link for the webinar in the chat. You're supposed to have a QR code there, but yeah, if you go into the chat, you'll be able to register there. I'll also be sharing that information via email. But again, that's Wednesday, November 12th on Therapeutic Plasma Exchange with Dr. Gary Kaplan. And we hope that we see you there. But again, thank you. And if you have any more questions and you think you might need to see someone like Dr. Gary or need to be pointed in the right direction with something, feel free to give us a call. We're happy to help, even if it's not us in our office directly. We are able to kind of help you with where you're at. And also, this was in partnership with the Foundation for Total Recovery. We serve to help the medical community learn more about these rare and complex immune-mediated chronic illnesses. We educate the medical field. We also help other support patients that may be suffering from illnesses as such. We're also going to be doing a lot more with our foundation next year, where we're going to be helping families with resources, with payments for treatments and such. So if you have any kindness in your heart today, feel free to give us a donation or learn more at foundationfortotalrecovery.org. But that brings us to the end. So thank you again, and hope you get a good night's sleep tonight, and we'll see you at the next one.
Pleasure, everybody. Thank you.